Hello, I'm Dr. Peterson, and I'd like to talk to you about carpal tunnel syndrome. We have a new technique that I am performing where we can do a carpal tunnel release with the SX1 microknife under ultrasound guidance. It is a micro-invasive technique and has improved healing time compared to the traditional method of release. Carpal tunnel syndrome is a syndrome where the compression of the median nerve as it goes through the carpal tunnel, or the space in between the carpal bones, gets compressed and then can cause atrophy of that nerve, weakness, and atrophy of the muscles that it supplies, as well as numbness and tingling in the fingers closest to the thumb. There's nothing that causes it directly, but there are a lot of things that put you at risk for it, such as obesity, arthritis in the wrist, previous injuries to the wrist or the carpal bones. Certain types of repetitive activities can cause carpal tunnel to be manifested, such as typing, or people that have to use their hands with a lot of wrist motion, or heavy lifting recurrently with the hands. You'll see it more in hand laborers. A lot of farmers and ranchers will particularly get it, and it will be exacerbated during peak season, such as planting and harvesting time. I would be seen for carpal tunnel syndrome or talk with your regular provider if you are having any numbness or tingling in the thumb and the first 3 fingers on the hand, or if you notice that you're dropping things or you're having some weakness with your grip, to see if you have carpal tunnel syndrome. If carpal tunnel syndrome is left untreated, many times the symptoms will progress. You can get more numbness and tingling in the hand. Sometimes it can manifest as really bad pain. It may wake you up at night and alter your sleep. Ultimately, the end stage progression may get to where the nerve completely atrophying and losing function and having permanent nerve damage. This can also result in the thumb muscles becoming really weak and causing chronic arthritis or difficulty with gripping things, and can, at a very extreme, leave the hand non-functional. The technique I use is micro-invasive carpal tunnel release with ultrasound guidance. We can thread a device that is the size of a pencil in through the proximal part of the wrist and underneath of the carpal tunnel ligament under ultrasound guidance. This allows us to avoid nerves and arteries that could potentially be in the way, and also create the smallest incision possible so as to make the healing time much quicker. Generally 1 to 3 days, and our average so far has been 1.6 days. Some of the studies have said anywhere from 3 to 6 days until you're back to full recovery. And then we are able to do it under local anesthesia in the office, instead of having to be put under general anesthesia. If you feel you have carpal tunnel syndrome, or you may have carpal tunnel syndrome and would like to be evaluated, you can give us a call at 308-995-4431 and either set up an appointment with myself or one of our other providers to see if you have carpal tunnel syndrome and would qualify for the release.